Welcome all. Today's lecture is about impotency and sterility. I am Dr. Sanil Kumar MC, working as professor and head of the department in Department of Forensic Medicine at Government Homeopathic Medical College, Kozhikode. We have to study certain definitions like impotency, sterility, etc. So coming to impotency, this is the inability to perform or take part in the act of sexual intercourse. Another term is called potent or potency, that refers to a male who is capable of performing sexual intercourse, and apta vira refers to a female who is capable of taking part in sexual intercourse. There is another term called impotent quad, which refers to a male who is impotent with a particular female and not with others. Frigidity means inability to initiate or maintain the sexual arousal pattern in females, and sterility is the inability to procreate, that is, inability to beget children in case of male or inability to conceive a child in case of female. Another term is called fertility, which is opposite to sterility. So, fertility means capability to reproduce. There is another term called sexual dysfunction, which is an impairment either in the desire for sexual gratification or in the ability to achieve sexual gratification. Now about the medico-legal aspects of impotency and sterility, certain civil cases and criminal cases are there in which uh, a question on impotency and sterility arises. In civil cases, in case of nullity of marriage, in case of divorce, as in section 12 Hindu Marriage Act 1955, in section 24 Special Marriage Act 1954. In cases of adultery, in case of disputed paternity and legitimacy, in suits of adoption, and also for claims for damages where loss of sexual function is claimed as a result of assault or accident. The criminal cases where a question of impotency and sterility arises include rape, adultery, unnatural sexual offences where impotence is pleaded as a defence, then impotence of sterility resulting from assault or injury, or when the mother puts forth a supposititious child. These are the cases where a question on impotency and sterility of a particular person arises. Now, what nullity of marriage? This is declaring a marriage as null or zero or void, that is, it never declaring as the marriage never existed. Legally, a marriage means physical union by coitus, and therefore, if the marriage has not been consummated or cannot be consummated, that is, consummated means making a marriage or relationship complete by having sexual intercourse, and if this happens, this does not happen, or a consummation does not happen, this marriage can be annulled. So, impotence is the male in the male existing since before marriage and being permanent is a valid ground for nullity of marriage as per Section 12 of Hindu Marriage Act 1955 and Section 24 of Special Marriage Act 1954. But sterility is not a ground for nullity of marriage. Impotency can be considered as a valid ground for nullity of marriage, but sterility is not a ground for nullity of marriage. Now, going to the medical examination for impotency. Any examination for impotency should be done only after recording first the reference number of requisition letter. We have to write down the number of requisition letter as well as the date of issue of requisition letter. Then we have to collect about the preliminary data, then 2 marks of identification, and lastly the written informed consent. The examination part includes recording of history, general examination, systemic examination, local general examination, and finally about the opinion. In history, we have to record especially about the past illnesses, any nervous diseases present or not, any mental diseases present or not, and we have to write a special note on the sexual history of the a person. Then we have to go for the general examination of the person. Then about the systemic examination, we have to examine all the systems, especially the central nervous system and psychology, and we have to look for the psychological problems. Local general examination includes development of we have to look for development of secondary sexual characters, We have to examine about the general development of genitals, any congenital anomaly in genitals, any local disease in genitals, any mechanical obstruction that cause hindrance to sexual intercourse, example, presence of a large hydrocele, scrotal hernia, elephantiasis, adhesion of labia, etc. Or you have to look for any growth or carcinoma in the genitals. These are the local general examination for the genitals. Then in case of nullity of marriage, we have to ensure that the cause of impotency is existing since before marriage, and the cause for impotency is permanent and cannot be corrected even after surgery, and that the impotency exists in relation to the marriage partner. We have to ensure these 3 points. First is the cause of impotency should be existing before marriage, and the cause of impotence is permanent and cannot be corrected even after surgery, and impotency exists in relation to the marriage partner. And finally, about the opinion, in case of if all findings or all examination findings are normal, you have to give a negative opinion. That is, after my examination of so and so, I conclude that there is nothing to suggest that he or she is incapable of performing or taking part in sexual intercourse. Or we have to write that if it is a positive opinion on impotency, then after my examination of so and so, I conclude that he or she is impotent because of the cause. Then about the medical examination for sterility, in case of a male, we have to examine the semen, and the semen is collected by masturbation after 1 week of no abstinence or not performing sexual intercourse. And if the semen is normal, the volume in each ejaculate will be about 3 to 5 ml. There are 60 to 120 million spermatozoa in each ml of semen. Then out of the total, 80% spermatozoa are motile. Out of the total, 80% of spermatozoa have a complete and intact morphology. That is morphology, the normal morphology of some spermatozoa is about 50 to 55 microns long. It should have a head, neck and tail, and the head being 5 by 3 micron. In case of female, medical examination for sterility in case of female, if she is fertile, she should have normal secondary sexual characters, normal development of genitals, normal menstruation, ovulation should be present. Then uterus will be of a normal size. She should have a patent fallopian tube, and also she should have a normal hormonal balance. Now about the causes of impotency and sterility in case of a male, the age is a very important factor or very important cause for impotency and sterility. So for males age, that is impotency, in case of impotency, very young males as well as very old are important. In England, a boy below 14 is considered impotent by law. And sterility is before puberty, that is about 13 to 14 years, a person is considered as sterile. Then going through the medical case records, at 2 years the penis and testes are well developed, and at 9 years there has been record that a person has become father, and at 94 years also somebody has become a father. From this data was collected from medical legal case records. In cause of impotence and sterility in male, that is in case of congenital malformation, there can be absence of penis, rudimentary penis, double penis, intersex states like Klinefelter syndrome, and sometimes penis can be adherent to scrotum. And some congenital malformations that may cause sterility include absence of testes, single testis, undescended testis, epispadiasis or urethral opening on dorsum of penis, or hypospadiasis, that is urethral opening on under surface of shaft of penis. This is undescended testis, that is it can be abdominal, it can be inguinal or suprascrotal. Ectopic testis means it can be prepenile, superficial ectopic, transverse, scrotal, femoral, or perineal. This is the position of urethral opening, can be glandular, coronal in case of first degree, then subcoronal, distal penile, or mid shaft or proximal penile in second degree, and penoscrotal, scrotal or perineal in third degree. There can be hypospadiasis and epispadiasis. Hypo means below, spadias means opening. So urethra opening may be below the penis. Then in epispadiasis, it will be above the penis. Urethral opening above penis. Hypospadiasis and epispadiasis can lead to sterility. Then some local and general disease that cause impotency include local diseases like syphilis, gonorrhea, priapism, phimosis and paraphimosis, mechanical obstruction like scrotal hernia, hydrocele, elephantiasis can cause impotency, general disease like hypertension, diabetes mellitus, tuberculosis, nephritis, fever and infections, neurological diseases like paraplegia, hemiplegia, injury to spinal cord, injury to vertebrae, etc. also may cause impotency. Another cause is carcinoma of penis. Sterility can be caused by local and general diseases like infection of testis, epididymis, prostrate or vas deferens. Then varicocele, mumps may cause orchitis, leprosy, syphilis, tuberculosis of testes, azoospermia or oligospermia. Oligospermia means less than 20 million per ml. Azoospermia means nil sperm per ml. Then testicular tumors as well as hormonal disorders. Some injuries and addictions like injury to head, spinal cord, cauda equina or penis, addiction to tobacco, alcohol, narcotics like morphine, pethidine, heroin, cocaine, barbiturates, cannabis, etc. and some antihypertensive drugs may lead to impotency in males. Injuries and addictions that may cause sterility in males include injury to both testes, heavy exposure to radiations, or heavy metal poisoning like lead, arsenic, etc. Some psychical causes may cause impotency and sterility in case of males. The most important and common cause of impotency in male can even cause first night impotency, that is fear, worry, mental depression, emotional disturbances, dislike for the partner, dislike for the act, fear of not being able to complete the act, overindulgence in sex, sexual perverts, excessive passion, etc. may cause first night impotency. This is basically a psychic type of impotency, and that person is not having sterility. Some operations on penis can lead to impotency like partial or complete amputation of penis, castration before puberty, etc. Some operations like vasectomy, orchidectomy or removal of testes may cause sterility in case of males. This is vasectomy. The vas deferens is cut into two and ligated separately. Now about the cause of impotency and sterility in case of females. Age, there is no age limit for impotency in case of females, because usually females are a passive partner, and legally a girl is considered potent at 18, that is age of marriage. For sterility before puberty, that is at 12 to 13 years, and after menopause, a lady is considered as sterile, and the legal age of menopause is 50. From medical case records, at 4 years sometimes menstruation maybe was seen in a girl. Then at 6 year or 8 months, a lady delivered a baby. At 10 years, a lady delivered twins, and at 63 years a lady delivered her 22nd child. These are some of the instances that is recorded in medico-legal case record in the world. Some congenital malformations of the female genitalia, like absence of vagina, infantile vagina, occlusion of vagina, adhesions of labia, and imperforate hymen, may cause impotency. And congenital malformations that may cause sterility in females include absence of ovaries, cystic or fibrous ovaries, absence of ovaries or fallopian tubes, infantile uterus, septate uterus, conical cervix, non-patent fallopian tubes, etc. This is a normally formed uterus. Then these are the incomplete formations of uterus. That is, if there is a problem in the formation of uterus, there can be complete agenesis, or it can be a unicornuate or dicornuate with a horn. If there is a problem in the fusion of uterus, the uterus can be a uterus didelphus, complete bicornuate, or partial bicornuate uterus. And sometimes it can be complete septate, partial septate, or arcuate. All these may cause problem in the fertility of the lady. Then some local and general diseases in the females may cause impotency, like vaginismus. And vaginismus is mainly a painful contraction of vaginal and perineal muscles during sexual intercourse. And another cause of local and general disease that cause impotency include ulceration or chancre of vagina, prolapse of uterus, stricture due to previous perineal tears, and finally carcinoma of vagina. Some local and general disease that cause sterility in females include infections of ovary, fallopian tubes, uterus or cervix, leukorrhea, acid discharge or acrid discharge from vagina, rectovaginal fistula, hydrosalpinx, large fibroids, ovarian tumors, carcinoma of ovary, carcinoma of uterus, carcinoma of cervix, prolapse of uterus, hormonal disorders, and sometimes there can be presence of antibodies against sperm. This is a picture depicting the presence of different types of fistulas. This is a vesico-uterine fistula. First one is vesico-uterine fistula. Then there can be a vesico-vaginal fistula. Vesico-vaginal fistula. There can be a urethro-vaginal fistula, or there can be a recto-vaginal fistula. Sometimes prolapse, like bladder prolapse, or rectocele or rectal prolapse, or uterine prolapse may be seen, which may contribute to sterility. Some injuries and addictions that may cause impotency in females include injury to the vagina, strictures due to scarring in vagina, then dyspareunia, that is pain during sexual intercourse. Some injuries and addictions that may lead to sterility in females include injury to both ovaries, heavy exposure to radiations, heavy metal poisoning, and drug addictions. Some psychical causes that may cause impotency and sterility in females include impotency may be due to vaginismus, that is a spasmodic contraction of the vagina due to hyperesthesia, or it can be due to hysterical fit. Some operations, that is a major surgery done on vagina, may cause impotency in females, or operations like tubectomy, oophorectomy, hysterectomy, etc. may cause sterility in females. This is a tubectomy, so the fallopian tube is cut and folded back and ligated to prevent further pregnancies, and sometimes partial, total, or radical hysterectomy may be done. Another term is functional impotency, which refers to impotency for which no somatic cause or no morphological cause can be found out. We are coming to the end of today's session. So the topic discussed today were the definition of impotency and sterility, medico-legal aspect of impotency and sterility, how to do the examination for female and male impotency, and finally about the causes of male and female infertility. Thank you.